Hi, I'm Gemma. What infant mental health means to me. As an adult, you always hear about mental health, but never in relation to babies or children. Becoming a mummy, this is not something I thought about, even though I knew how important it is to sing, talk, and connect with your baby. Through completing the baby massage and yoga course, it gave me confidence in my ability as a parent to make these connections through them and see the enjoyment they brought to my son as well as to me. It also gave me the confidence to go to other classes like baby swimming, which was so beneficial for me and my son, and to watch his natural reactions when put underwater and see his developments. So while I don't think about the term infant mental health, I know that time spent with your child, teaching them, talking to them, and taking them to classes will help their development and mental well-being and help them to interact with other children. I have found it so important in my child's development. Thank you.
I'm delighted to make this contribution to the launch of the Belfast Trust Infant Mental Health Strategy. It's great to see the Belfast Trust spearheading work in this area that was established in the PHA Infant Mental Health Framework that was published in 2016. One of our key ambitions across the executive is to give every child the best start in life. This is a key theme within our Making Life Better public health strategy. Since taking up my post in January last year, I've made it very clear that mental health is a priority. For children and young people, mental health is especially important, and a focus on younger age groups can prevent future issues occurring. If we work to create resilience to meet life's challenges at an early age, we can support our population to have a reduced incidence of mental health conditions. We can do this by addressing attachment, understanding and resilience early. The vision for this infant mental health strategy is to provide prevention and early intervention and support the development of positive social and emotional well-being within our services to ensure that all children living in Belfast have the best start in life. Today's launch is very timely as there will inevitably have been a much increased pressure on families with newborns in the COVID context, and we all need to work even harder to ensure support in the period ahead as a consequence. Evidence has clearly shown the detrimental effect of multiple adverse childhood experiences on future well-being. Research has demonstrated that around 45,000 of children and young people in Northern Ireland have a mental health need at any one time. More than 20% of young people are suffering significant mental health problems by the time they reach 18. A regional assessment of need has shown that young people identify mental health as the biggest challenge for them. I'm particularly aware of the impact of the first 3 years of life on the future health and well-being of our infants. Over recent years, we have seen the expression of evidence-based training and practice and the implementation of the PHA Infant Mental Health Plan and addressing adverse childhood experiences. Several practitioners that have completed training in previous years have now secured specialist posts in new models of service delivery that are being established across Northern Ireland. The Belfast Trust Infant Mental Health Strategy that we are launching today very much complements this work and will help deliver our ambition of ensuring every child receives the best start in life. The strategy provides an opportunity to prioritise the agenda with all who engage with children throughout their development to make every contact count towards building a resilience that will support them throughout life. And I would like to close by adding my personal thanks to everyone involved in this excellent work. I have no doubt that through this strategy we will improve the mental health and resilience of our future generations in Belfast.
Good morning. I'm Fiona Meenan, Senior Manager for Health Improvement in Belfast Trust, and I'm very glad to have the opportunity to say a little about infant mental health and what it means to us in the Health Improvement team. So we share the Belfast Trust aim of improving health and most particularly working to address the very real differences that exist in how our population experiences health across their lives. Many conditions that negatively impact health are avoidable and preventable with the right information, training, funding, intervention at an early stage. So with health improvement, we work with partners, including service users, to raise awareness and provide training, funding and planning to promote health and well-being. So we work across areas such as physical activity, sexual health, stopping smoking, mental and emotional health, all the areas that impact long-term health. And we recognise none of these operate in isolation. For us, infant mental health is core to getting it right early, to give every child the best start in life. Within the health improvement team, we have a dedicated child development intervention coordinator post, and that is to progress the infant mental health and the wider child development agenda. This post is funded through the Public Health Agency in response to the evidence that supports early intervention and prevention. Indeed, similar posts exist across Northern Ireland in each of the trusts, and all are supported by the National Children's Bureau. The Child Development Intervention Coordinator role is about supporting communication and building relationships with those working to improve the health and well-being of children, young people and families. And that's including service users, statutory, community, voluntary organisations. The role is about embedding parenting support programmes within the Belfast Trust area to promote the health and well-being of parents, children, families. And it focuses on building knowledge, capacity and accessible training in parenting support programmes, such as the Solihull approach, the Incredible Years programme and the 5 to Thrive programme. So by embedding such programmes, we would hope to avoid or at least reduce the need for referrals to Tier 3 services such as CAMHS. The evidence suggests that involvement in these programmes can increase confidence, enable good care decision making, enhance social networks and reduce isolation and loneliness, which is especially important at present, where normal family, neighbourhood, friend interaction are all reduced because of the pandemic. Within the health improvement team, we also coordinate the Roots of Empathy programme. Now, this programme is running across 27 schools in Belfast. It's a classroom-based programme and it promotes social and emotional competence and increases empathy. And in fact, the baby is the teacher within the programme. So to conclude, infant mental health is a real priority for the health improvement team and across the trust, and particularly in the context of the pandemic and how it will impact on parents, children and young people as we move forward. Thank you.
Hi, I'm Lisa Dara. I'm Midwifery Coordinator for Perinatal Mental Health and Social Complexity in Pregnancy, otherwise known as the SWAN Midwife, and work as part of the SWAN team and SWAN Clinic here in Royal Maternity. The SWAN Clinic provides care to our most vulnerable women, including mental health, addiction and social complexity. For these women, building connections and focusing on their infants can be challenging, and this leads to poor maternal and infant mental health. The cost of maternal mental health to the UK is over 8 billion, and over 6 billion of that is in relation to the child. Infant mental health begins with the mother and pregnancy. The baby's brain starts to develop within the womb, and anything we can do as midwives and health professionals to enhance this connection and help the developing bond between mother and baby builds the neural pathways during pregnancy and those early postnatal days. This gives mums and babies the best chance of achieving positive outcomes. As the baby needs to be nurtured, so often do our mothers, and as midwives in the SWAN Clinic, we aim to provide a holistic level of care, encouraging engagement with services, working in partnership with women, enabling them and their babies to reach their full potential.
Hi, I'm Lisa, and I'm a health visitor working in the Belfast Trust. As a health visitor, I think it's important that we recognise the crucial role the profession holds in relation to infant mental health. When we look at infant mental health, we need to incorporate the entire family unit. Health visitors are valuable when addressing infant mental health because they are in the best position as their role begins in the antenatal period and continues throughout a child's early life. Health visitors are able to build those therapeutic relationships and have numerous opportunities to engage with families in their home setting. When a child is born, the health visitor remains the constant support to that family, and they gain opportunities to identify a level of need, offering support and educating parents in the many important aspects within a child's development. And these would include attachment and bonding, skin-to-skin contact, brain development and stimulation, and focusing on positive behaviours. One of the most important elements in child's development is early intervention and identifying those needs early so that it can be addressed and appropriate support networks put in place. Health visitors play a vital role in early intervention, leading to more improved outcomes and that promotion of positive infant mental health. Health visitors are equipped with the skills to build upon the universal Healthy Child, Healthy Future framework through the newly established Early Intervention Transformation Programme, which primarily focuses on health promotion, additional support and intervening early to reduce the risk of poor outcomes. The Solihull approach is a significant framework used by health visitors to securing attachment and bonding from pregnancy and throughout a child's early life. Positive and secure attachments can help a child establish more positive outcomes in their physical, their mental and social relationships. The Solihull approach also incorporates the importance of brain development and promoting brain stimulation, which does play a key role in early years of a child's development. Lack of brain stimulation can lead to emotional barriers and potential lifelong behaviours. So when we look at infant mental health, it is important that we recognise intervening early, supporting parents, building capacity, preventing problems and maximising outcomes, and therefore it is clear to see that the positive impact that health visitors offer towards the promotion of positive infant mental health. Thank you.
Hi, I'm Luke. I'm a daddy to a 1-year-old, and I'm just here to talk a wee bit about infant mental health. So obviously mental health is a big topic in 21st century now, so more than ever, but never really hear much about infant mental health, and I honestly never heard much about it until we were expecting Arthur and we enrolled in the Getting Ready for Baby programme through the Belfast Trust. And yeah, it was a real eye opener to see how much the baby's mind develops even before birth, and how the connections that are made can really affect children and their mental health, and that can affect mental health in later life as well. And then with the VIG sessions, it was very informative, and it learned a lot more just about how the baby develops while they're actually growing. So it's great that there's an infant mental health strategy coming, and that there'll be more resources for programs like this and more information about infant mental health.